along with the blood, filling the left ventricle and perfusing ventricle walls and tissue. Microbubbles can be coated with compounds such as albumin, surfactants, lipids, or synthetic polymers, and they're filled with air or high molecular weight gases, which are more easily compressible than the surrounding fluid. Now, this means the bubbles will be more reactive than surrounding fluids to ultrasound frequencies, making their reactions easier to identify. So, how exactly does contrast interact with ultrasound to give us the images we see on the screen? When contrast bubbles react to sound waves, they reflect and scatter these sound waves better than the surrounding tissue. This reaction allows us to translate the contrast signal as brighter than the surrounding tissue signal, making it easier to distinguish between tissue and areas containing contrast. The two main factors used to control contrast microbubble reaction are the ultrasound transmit frequency and the power, or mechanical index, at which the ultrasound pulse is transmitted. Let's talk about ultrasound transmit frequency first. Contrast bubbles respond to ultrasound by contracting and expanding at a frequency similar to the transmitted pulse. Using a generic frequency as an example, you can see that the high part of the sound wave applies positive pressure to the bubbles, which compresses them. The low part of the sound wave applies negative pressure to the bubbles, causing them to expand. Lower frequencies, the larger the reaction. In general, bubbles have a much greater capacity for expanding than they do for contracting. Bubbles can't expand indefinitely, however, and at a certain point, they weaken and break. This is called bubble destruction. Ultrasound frequency is one factor used to control bubble destruction. There are other impacts of ultrasound frequency as well. Manipulating frequencies allows us to balance image optimization variables, such as resolution, penetration, and texture. Benefits of lower frequencies include uniformity of beam and greater penetration. Benefits of higher frequencies include higher resolution and reduced bubble destruction. In order to optimize contrast images, the right ultrasound frequency needs to be balanced with the power at which the ultrasound pulses are transmitted. This power range, called the mechanical index, or MI, is the second factor we use to control bubble response. MI gives an indication of the estimated peak negative pressure to which the tissue is exposed. Higher MIs correspond to a higher transmit power. This returns a larger signal and a brighter image, but destroys more bubbles. Higher MIs are sometimes used for perfusion research, together with triggered imaging techniques. Lower MIs correspond to a lower transmit power and are used to cause a sustained bubble response with less bubble destruction. Lower MIs are used for techniques such as LVO, which work best using a low to mid MI, 0.2 to 0.6 for example. This MI transmits enough signal intensity to create a clear image while minimizing bubble destruction, which increases the uniformity of opacification in the left ventricle. In general, contrast agents can be used to improve the quality of many echocardiograph images. This improvement can aid in faster and more accurate diagnosis and can improve the accuracy of assessing left ventricular cavity size, wall thickness, and wall motion. Contrast can be used for Doppler enhancement, stress echo, contrast color kinesis, and in various research techniques involving myocardial perfusion.